Questions 421 to 460. For 21, a mother asked the nurse that while she was changing the diaper for her female newborn, she noticed a brick red stain on it. What is the best response by the nurse? A. It is a sign of low iron excretion. B. It is expected in female newborn. C. It is due to medication given to the mother. D. It due to medication given to the newborn. The answer is B. It is expected in female newborn. For 22, a nurse is assessing a 4-month-old formula-fed infant. The parent reported that the infant was irritable, crying excessively, not sleeping well, and vomiting. Gastroesophageal reflux is expected. What nursing intervention should the nurse expect to each parent? A. Place in an infant's seat after eating. B. Give frequent feedings. C. Position the child in a swing. D. Thin formula with water. The answer is A. Place in an infant's seat after eating. For 23, the normal systolic BP for newborn. A. 40 to 60. B. 60 to 80. C. 80 to 100. D. 100 to 120. The answer is B. 60 to 80. For 24, neonatal mortality rate. A. 1 ratio 100. B. 1 ratio 1000. C. 1 ratio 100,000. D. 1 ratio 1 million. The answer is B. 1 ratio 1000. For 25, newborn stomach capacity. A. 6 milliliters. B. 12 milliliters. C. 28 milliliters. The answer is 6 milliliters. 426. For 30, old gravid 1 and Para is now planning to become pregnant within the next year. The patient herself had born with neural tube defects, which were surgically repaired in early childhood. The nurse recommends that the patient begin taking tablet of folic acid. How many micrograms would be most appropriate for this patient? A. 400. B. 600. Circa 1800. D. 4000. The answer is A. 400. For 31, a 2-month-old infant with cleft lip is seen in the primary healthcare to get the regular vaccine of 2 months. The mother asked proper time for the corrective cleft lip surgery of her infant. Which of following is the best nurse response? A. No specific age for repair of cleft lip. B. It is too late, repair should be done immediate after delivery. C. The age of 2 months old is the time for repair. D. The proper time for repair after the age of 1 year. The answer is C. The age of 2 months old is the time for repair. For 32, a nurse is assigned to care for a child after a cleft palate repair. Which of the following types of restraints is very effective for child? A. Mummy restraint. B. Elbow restraint. C. Wrist restraint. D. Mitt restraint. The answer is B. Elbow restraint. For 33, a 4-month-old infant returned immediately for more room post-cleft lip repair. Which of the following nursing intervention should be considered? A. Apply elbow restrain. B. Apply suction when needed. C. Measure temperature. D. Put infant in prone position. The answer is A. Apply elbow restrain. For 34, the nurse had been teaching a new mother how to feed was born with a cleft lip and palate before surgical repair. Of which of the following action from the mother indicate teaching has been successful? A. Burping the baby frequently. B. Prevent the infant from crying. C. Placing the baby flat during feeding. D. Keep the infant prone following feedings. The answer is A. Burping the baby frequently. For 35, mother came to the outpatient department with an infant having cleft and palate. The infant was underweight, so the nurse has to consider teaching the proper way of feeding the child in the treatment plan. Which of the following is the proper way of feeding? A. Use a non-squeezable bottle during feeding. B. Feed infant in an upright, sitting position. C. Enlarge nipple holes of bottle to allow more milk to pass through. D. Feed infant longer than 45 minutes to allow more food to be small. The answer is B. Feed infant in an upright, sitting position. 436. A 40-year-old woman is a gravida 2, para 2, and is current conceive. Her previous pregnancy resulted in the birth of a cleft lip and palate. The patient is anxious and concerned pregnancies, and the nurse provides genetic counseling and which foods would most effectively prevent recurrence of palate. A. Green vegetables and citrus fruit. B. Eggs, milk and dairy products. C. Wheat, corn, rice, oats and rye. D. Beef, chicken and yellow vegetables. The answer is A. Green vegetables and citrus fruit. 437. A nurse is caring for a newborn with cleft lip. At which age would the nurse expect the doctor to perform? A. 3 to 6 months. B. 6 to 10 months. C. 11 to 14 months. D. More than 14 months. The answer is A. 3 to 6 months. 438. A 2-day-old newborn is admitted to the nursery. While the nurse is administering oral feeding, the milk returns through the child's nose and mouth and the infant becomes cyanotic. Which of the following condition the newborn should have? A. Anorectal malformation. B. Tracheoesophageal fistula. C. Cleft lip and palate. D. Cardiac condition. The answer is B. Tracheoesophageal fistula. 439. A newborn admitted to the NICU with tracheoesophageal fistula, TOF. Which of the following nursing intervention should be included? A. Elevated the head for feedings. B. Elevating the head but keep the child NPO. C. Insert a nasogastric tube for feeding. D. Encourage the mother to breastfeed. The answer is B. Elevating the head but keep the child NPO. 440. A full-term newborn admitted to the neonatal intensive care unit with diagnosis of tracheoesophageal fistula. Which of the following nursing measure to prevent pulmonary complication and improve good prognosis of the newborn condition? A. Encourage exclusive breastfeeding. B. Insert nasogastric tube for gastric decompression. C. Intermittent suction by double lumen catheter. D. Prepare for the insertion of tracheostomy. The answer is C. Intermittent suction by double lumen catheter. 441. A nurse is caring for a 14-month-old immediately after a surgical repair of cleft palate. In which position of the following should the nurse put the child? A. Prone. B. Lateral supine. The answer is A. Prone. 442. A 9-month-old child who has a repair cleft palate, the nurse explaining mother on how she will give feeds to her child. Which of the following instruction can be expected to include feeding education? A. Open cup. B. Teaspoon. C. Bottle feed. D. Special bottle feed. The answer is A. Open cup. 443. 26. Which of the following vitamin supplements can decrease the incidence of neural tube defects such as anencephaly and spina bifida newborns? A. Vitamin A. B. Riboflavin. C. Folic acid. D. Vitamin K. The answer is C. Folic acid. 444. All of the following are types of spina bifida except A. Myelomeningocele. B. Hemophilia. C. Meningocele. D. Spina bifida occulta. The answer is B. Hemophilia. 445. While caring for a neonate with a meningococcal, the nurse should avoid positioning the child on the A. Abdomen. B. Left side. C. Right side. D. Back. The answer is D. Back. 446. Infant is born with spinal bifida. Which of the following complication is always found in these infants? A. Hydrocephalus. B. Craniosynostosis. C. Meningitis. D. Cerebral palsy. The answer is A. Hydrocephalus. For 47, on the second day of hospitalization for ventriculoperitoneal shunt revision, a child with spina bifida developed hives, itching and wheezing. The nurse should determine if the patient has been exposed to A. Peanuts, B. Strawberries, C. Eggs, D. Latex. The answer is D. Latex. For 48, infant with spina bifida, the nurse should monitor A. Head circumference, B. Abdomen circumference. The answer is A. Head circumference. For 49, position for the baby with spina bifida is A. Prone position, B. A back, C. Supine. The answer is A. Prone position. For 50, a full-term infant is admitted to NICU with a diagnosis of spina vital signs are stable. Which of the following positions is suitable for this infant? A. Supine position, B. Semi-Fowler position, C. Prone position, D. Sitting position. The answer is C. Prone position. For 51, blank is a congenital anomaly also known as congenital aganglionosis or aganglionic megacolon. The disease occurs as the result of an absence of ganglion cells in the rectum and other areas of the affected intestine. The answer is Hirschsprung's disease. For 52, at 24 hours after delivery, the nurses noted that the newborn failed to pass meconium. This indicates which of the following condition? A. GERD, B. Pyloric stenosis, C. Failure to thrive, D. Hirschsprung disease. The answer is D. Hirschsprung disease. For 53, a nurse is assessing a 6-month-old infant that has reduced responsiveness and interaction with the environment to smile or make eye contact. The nurse notices that the attempt to hold or comfort the crying infant. What diagnosis should the nurse anticipate? A. Celiac disease, B. Failure to thrive, C. Cystic fibrosis, D. Growth hormone deficiency. The answer is B. Failure to thrive. For 54, a 3 days old newborn is diagnosed with Hirschsprung disease. The nurse is conducting a physical examination. Which of the following findings will alert the nurse to suspect this disease in the newborn? A. Palpable sausage-shaped mass, B. Cyanosis of fingers and toes, C. Failure to pass meconium within 24 to 48 hours of life, D. Weight less than expected for height and age. The answer is C. Failure to pass meconium within 24 to 48 hours of life. For 55, a 9-month-old child is diagnosed Hirschsprung disease scheduled for surgical operation. Which of the following should the nurse understand the purpose for surgical intervention? A. To remove the ganglion portion of the bowel, to relieve obstruction. B. To maintain optimum nutritional status growth, the intertinal. C. To stimulate intestinal adaptation with internal feeding. D. To minimize complication related to the disease. The answer is A. To remove the ganglion portion of the bowel, to relieve obstruction. For 56, a 9-month-old child is diagnosed with Hirschsprung disease. He is scheduled for surgical operation. Which of the following is the most common complication expected during this age? A. Mechanical obstruction, B. Enterocolitis, C. Pleural effusion, D. Esophageal artesia. The answer is B. Enterocolitis. For 57, an 8-month-old infant is admitted with Hirschsprung disease. Which of the following would be a significant finding in this infant? A. Depressed anterior fontanelle, B. Polyuria, hematuria, C. Weight gain, edema, D. Failure to thrive, constipation. The answer is D. Failure to thrive, constipation. For 58, the nurse is assessing a 2-year-old child with Wilms surgery. Which of the following should the nurse avoid? A. Putting the child in lateral position, B. Palpating the child's abdomen. C. Putting the child in a private room. D. Provide mouth hygiene 30 minutes after meal. The answer is B. Palpating the child's abdomen. For 59, a 9-month-old child is diagnosed Hirschsprung disease scheduled for surgical operation. Which of the following should the nurse understand the purpose for surgical intervention? A. To remove the ganglion portion of the bowel, to relieve obstruction. B. To maintain optimum nutritional status growth, the intertinal. C. To stimulate intestinal adaptation with internal feeding. D. To minimize complication related to the disease intussusceptions. The answer is A. To remove the ganglion portion of the bowel, to relieve obstruction. For 60, a nurse is taking a history from the infant parents who have a suspected diagnosis of intussusception. Which of the following assessment question would be most helpful? A. Do you breastfeeding your child? B. What does your child's stool look like? C. How often your child urinating? D. What is the color of your child urine? The answer is B. What does your child's stool look like?